Hello and welcome to GP Talks, where we talk about important topics that matter to you. I'm Dr. Hannah Waddingham. This short video explains what's changed in the NHS routine vaccination schedule, which was updated in January 2026. You may know chickenpox as a common childhood illness. For many children, it's mild, but for some, it can be more serious and lead to complications or hospital treatment. The updated programme helps protect children earlier before they start mixing more with other children at nursery, playgroups and other early year settings. Children are now offered a combined vaccine called MMRV. This single vaccine protects against measles, mumps, rubella and chickenpox, giving 4 important protections together as part of the NHS routine vaccination schedule. The first dose is given at your child's routine 12-month appointment instead of the MMR vaccine. A second dose is now given earlier at a new 18-month appointment for children born on or after the 1st of July 2024. Some children will follow a short transition schedule. If that applies to your child, we'll contact you directly. The MMRV vaccine is safe, well tested and widely used. It can be given even if your child has already had chickenpox or if they've previously had the MMR vaccine. Giving these protections together is the safest and most effective way to protect children as they grow. It's completely normal to have questions about vaccinations, especially when there's a change to the routine schedule. Parents have asked about febrile convulsions, and I'd like to take a moment to explain what they are and when they may occur. Some young children can develop a high temperature or fever when common infections like measles, chickenpox or flu. When this happens during the fever, a small number of children may have a short seizure, also known as a fit. These are called febrile convulsions and usually last a few minutes. Around 1 in 25 children will have a febrile convulsion by the time they turn 5. They are most common in children aged between 6 months and 5 years. The most important thing to know is that children who are unvaccinated and catch measles are much more likely to have a febrile convulsion than children who have been vaccinated. If you think your child may be having a febrile convulsion, please seek medical help urgently. You can find more information, including a full list of expected side effects, in the NHS patient leaflet available at your practice or the NHS website. What's important to remember is that these infections can spread before symptoms appear, which is why vaccination works best before children start mixing more with others. For most families, children are already up to date with their routine vaccinations, and this change simply helps keep that protection in place as part of early years care. If you've received a message, it means your child is now due or overdue for their routine MMRV vaccination. Please book your child's appointment using the link in your message or by contacting the practice. If you're unsure whether to book or you're not certain what your child needs, our team will be happy to help. You can also check your child's Red Book or contact your practice if you're not sure whether they're up to date. If your child was unwell when their appointment was due or you missed an appointment, please don't worry. We understand that other things can crop up. You don't need to start again, just book the next available appointment and we'll take it from there. Vaccination is always your choice. As part of the NHS routine vaccination schedule, these protections are given together in one vaccine. Separate MMR or single chickenpox vaccines aren't routinely offered, and GP practices aren't able to provide alternatives privately. Thank you for taking the time to watch. If you have any questions, please get in touch. We're here to help.